what makes this wisdom tooth such a difficult extraction. Access to section this tooth was very difficult because of the second molar. Create the space, section to the furcation, elevate the distal piece, and then elevate the mesial piece. So it's easier drawn than actually done. So I'm making my cut along the ramus. Don't make your cut past the lingual of the second molar. You don't want to damage the lingual nerve. So keep it on the ramus. So cut here, and then I'm going to cut through here. Remove the tooth, you've got a space, and you've got more tissue than you need, and that allows you to close the flap completely. Then this is a number 4 or 6 long shank round burr, removing the occlusal part of the bone to gain access to the wisdom tooth. Remove the distal bone, as the distal part of the tooth is very tight. You want to be careful not to touch the second molar. Very important to have a good radiograph so you have a visualization of where the tooth is. I'm reflecting a little further so I can reflect a big flap. I don't suggest you try one of these unless you've had considerable surgical hands-on training. Trying to section to the furcation, so I know I don't want to go more than 10 millimeters from the coronal to the furcation, because you don't want to take any chance at all damaging that inferior alveolar nerve. You can see the distal piece is elevating, but there's so much for this piece to bump into that I'm having to remove more of the tooth structure. Ideally, you'd rather remove the distal root and distal coronal part first. I'm trying to move that up, but it's hitting the distal part of the socket. I'm creating a little more space. So there's the distal root and the distal part of the crown. I want the piece to come out. There's that distal root. Now I've got to remove the mesial part, and it's complicated because it's so wedged in. I'd place this instrument to try to remove that mesial piece. This part right here is sticking on the distal part of the socket, and then the mesial part of that piece is bumping the second molar. So I've got to remove part of the distal and the mesial of the crown. So you see I'm getting movement, but here's the distal part of that piece I'm removing because it's hitting this back part of the socket. And just creating space. And here it comes. Remove follicular sac, so here's how it fits together, both the roots. And then we're going to pack it. I've never had a dry socket in 40 years because I packed the mandibular impacted wisdom teeth with this paste and surgical gauze every time at the time of surgery. So there it is, sutured tight. That's the Dental Minute. These techniques work, and they work every time.